The second component of SAFE, assessment. So when we think about assessment, we're going to assess two different things. We're going to do part of our assessment on the patient. We need to know if they're going to show us risk factors for jams. And then the second piece of that is assessing or thinking about our dental procedure. So let's go to the patient first. We start our patient assessment with a JAMS assessment questionnaire. We actually have separate videos on going through that assessment with a patient, so you can watch me actually have that dialogue with a patient, as well as the next piece, which is measuring range of motion. So when we think about range of motion, what we want to do is find out at a comfortable opening, is the patient in what we would call the low risk zone from 40 to 60 millimeters, or are they going to be in a higher risk category, below 40 millimeters, above 60 millimeters? And those are two simple ways we can start to see, is this low, moderate, or high risk? The next piece of the puzzle is to look at the procedure. This is probably going to seem pretty self-explanatory, but when we think about a low-risk procedure, we're going to think about procedures that are very short duration, that are definitely more anterior in the mouth so that we don't need to ask the patient to open their mouth as long. We're going to think about procedures where we're putting less stress on the lower jaw. We're not pushing down and forcing that patient open. So what we do is we put those two things together. We put the patient's risk factors together with the procedure's risk factors, and we're going to put that in one of three boxes: low, moderate, or high. If a patient and the procedure together fall in the low risk assessment box, we really are not worried about the potential for jams to develop. As soon as we have a patient and a procedure combination that has us thinking moderate to high risk for jams to develop, now we have pretty simple management strategies we can do that'll actually prevent jams from happening and also set us up to evaluate post-operatively in case jams presents itself, so we can get very quickly to treating. We call it speed to treat, which is a significant factor in preventing long-term problems. So when we start to think about moderate or high risk, what are we looking at? We're looking at patients who answered their assessment with a lot of yes answers versus no answers. They already are telling us they've had a history of problems around their jaw joints or their muscles. We're looking at patients who have a range of motion that's less than 40 or greater than 60. Procedurally, we're now starting to talk our longer appointments. We're talking about procedures in the posterior part of the mouth, or procedures that put a lot of pressure on the mandible. So if you're already thinking about, well, in my practice, I do a lot of longer procedures. That's one of the things I'm passionate about, is cosmetic dentistry or more complex reconstructive, restorative dentistry. I'm watching this as an oral surgeon or a periodontist, and those procedures are what I do day in and day out. One of the gifts of JAMS protocol is that instead of having to manage that at the back end, you're actually preventing it at the front end. It's a much more efficient way to practice. It's also much better from a patient management and patient health perspective. So what we're going to do next is we're going to actually talk about how we manage those specific moderate and high risk patients.